Okay, so we're now going to do the upper extremity, and the upper extremity is a little bit more difficult to do, only because the upper extremity has a lot more mobility than does the lower. So what we're looking at actually is the anterior kind of lateral aspect of the arm. And if I kind of pan down, there's the elbow. And then because of the pronation, we're seeing actually the posterior aspect of the forearm. So I'm going to have to do a little bit of rotation here to kind of see a little bit better the muscles of the superior upper extremity. So we'll start off, and the very first muscle we see quite nicely is deltoid. Deltoid is this nice triangular muscle. I'm going to kind of wrap the contours of it. There's deltoid. Its origin is going to be the clavicle. You can see it up here. Here's the clavicle. So I'm going to have an origin on the clavicle, and it's going to come out to the acromion, and then around the acromion, so it's on the scapula, all the way back down on the spine. Okay, so we have clavicle and scapula as the origin. It's a pretty wide origin. And then it has an insertion, which is quite distinct. It's going to narrow all the way over here to that deltoid tuberosity on the humerus. So origin would be clavicle and scapula. The insertion would be the humerus, and action is going to be to abduct or raise the shoulder away from the midline. Okay, so you can see the really nice fascicles here in that deltoid muscle. So this makes the prominence or the roundness to your shoulder. Just to give us reference over here, although we're not going to study it right now, that would be the pectoral muscle. Okay? That's a pectoralis major. All right, so now we're going to look down into the arm, and the muscle that we first see, the most superficial muscle of the forearm, or sorry, of the arm, is this muscle right here. I put my fingers underneath it. That's the bicep brachii muscle. Bicep brachii has two heads, and they kind of get tucked up underneath deltoid here. But if I put my fingers, I can split the heads a little bit. The medial head is actually the short head. So this is the short head of bicep. And this lateral head, it's actually a little bit more narrow. And that's going to be the long head. So this is the long head is lateral, and the short head is medial. And we have the belly of the muscle, and it's going to come out. It's going to go all the way down past the elbow joint to insert on to the radius at that radial tuberosity. So we have this really thick tendon kind of diving down into the forearm. Now, there's a lot of fascia here because we, in this dissection, want to leave the vasculature in place. So that's why we have a little bit more fascia here in the elbow. But this is the nice bicep muscle, and it's going to be the first of three elbow flexors. Okay. All right, just medial to the bicep is this little muscle. It's also deep to the bicep. You can see it right here. It's actually coming off of the humerus, and we can see it going all the way over here, actually originating in this location deep to pectoralis major. It's that coracoid process. In fact, the short head of the bicep and coracobrachialis are originating both off of that coracoid process. So if I were to follow coracobrachialis here and the short head of the bicep here, they both go deep and grab onto that coracoid process. Now, coracobrachialis is named coracobrachialis because of its origin and insertion. Origin is the coracoid process. Obviously, the insertion is the humerus, and its job is to adduct the humerus. So deltoid and coracobrachialis are in fact antagonistic to each other. Okay, so now we have our deltoid, our bicep brachii, and our coracobrachialis muscle. If I look underneath bicep brachii, I'm going to see there's a muscle that literally covers the entire anterior shaft of the humerus. So that muscle right there. This muscle is actually called brachialis. And brachialis is the second of our elbow flexors, and it's basically the base of the arm, covers the shaft, anterior shaft of the humerus, goes straight through the elbow joint, and it's actually going to be attaching down on the ulna. So it's going to be giving us elbow flexion. Okay, so that's brachial, yeah, that's the brachialis muscle. Okay. All right, so now I'm going to move a little bit more lateral, and I'm going to rotate the extremity here. So this is the elbow, that's the olecranon. I have my big tricep muscle posteriorly, so here's the tricep. That's going to be our nice elbow extensor. And what's nice is if we look at this lateral view, it's quite beautiful. You can see the tricep is this muscle coming this way. That's the elbow extensor. Tricep meaning 3 heads. We're actually looking at the lateral head. And we can see a quite significant amount of brachialis. That's this one, brachialis. And make the separation here. So this is brachialis right here. There's a nice V. Body has a lot of muscular V's. So this is brachialis, and that's tricep. Right between them is this muscle here that comes off and goes all the way down past the elbow joint and all the way down over here to the styloid process of the radius. So this muscle, oh, there we go, this muscle is called brachioradialis. So it's coming off of the brachium, which is the humerus. You can see here, it's coming off the shaft on this lateral epicondyle, and then it's traveling past the elbow joint, so it does do elbow flexion, and all the way over on the styloid process of the radius. So if you give yourself a thumbs up and then flex, you should be able to see this nice rounded sort of muscle in the lateral aspect of your forearm kind of bulging. Okay? So that's brachioradialis, and it kind of sits right between tricep, which is an elbow extensor, and brachialis, which is an elbow flexor. Okay, so there's brachioradialis. Now what we're going to do is I'm going to rotate in a supination the upper extremity, and we're going to look probably the most difficult aspect of the upper extremity, which is the forearm. So let's see how well I can do this. All right, so when we look, we're going to notice that there are a lot of tendons here in the forearm. So these are all tendons of different muscles. Okay, and what I'm going to do is kind of arrange them. So for me, I like to find, oh, there you go, my brachioradialis first. It's kind of a nice landmark. So here is my brachioradialis muscle. It's coming down. So if I look medial to that brachioradialis, I'm going to see 3 tendons. 1, 2, and yeah, grab it. 3. Those 3 tendons are wrist flexors. So the one in the middle is our palmaris longus. You can see it has a really, really long tendon, and that's originating off of the medial humeral epicondyle, and it's actually inserting into what we call the palmar fascia. So it's actually inserting into the thick connective tissue in your palm. So that's palmaris longus. So that's this one in the middle right here. And then if I look on the lateral side, this hand is in standard anatomical position at this point. So that should be on the radial side. So this is carpi flexor radialis. I should say flexor carpi radialis. And I go all the way to the other side. This guy is flexor carpi ulnaris. So all 3 are wrist flexors, so they tell you that. Flexor, so start with flexor, and then you either say carpi radialis, which is the one on the radial side, or flexor carpi ulnaris, which is the one on the medial side. And right in the center is palmaris longus. So those are the 3 wrist flexors. They all originate off of the medial humeral epicondyle. And if we're looking at insertion points, kind of depends on which one you're looking at. But if we look at the flexor carpi radialis, it's going to insert onto metacarpals 2 and 3. And if we look at flexor carpi ulnaris, that's going to insert onto the metacarpal number 5, and then that little pisiform and hamate bone. And we can't see that because the skin in the hand is still present here on this particular cadaver, but we'll know where those go. They're going onto metacarpal bones, so we can flex the wrist, and then some of the little carpal bones. Right now, if I go deep to the 3 carpi flexors, so again, this is brachioradialis on this side, so there's our brachioradialis muscle. Here are 3 carpi flexors. I'll notice that there's still muscle deep. So what I'm going to do is kind of look underneath, and I'm going to pick up this big muscle. It's kind of sitting underneath. So that big muscle is actually called flexor digitorum superficialis. Has a super long name, kind of cool, but tells you what it's doing. Flexor carpi, oh sorry, let's start again. Flexor digitorum superficialis. So this muscle right here is deep to our wrist flexors. And remember, these are our 3 wrist flexors up here. So if I move those wrist flexors deep to that, it's this guy. So again, flexor digitorum superficialis. It's originating off of the humerus, a little bit of the radius, and then it goes into the palm, and it's going out to the digits. Okay? So if I look at our flexor digitorum superficialis, okay, so originating primarily off the humerus, has a little bit on ulna and radius, but primarily on the humerus, and then insertion is going to be on those phalanges. Okay, so then if I go deep to the flexor digitorum superficialis, there's still more muscle underneath. This may be hard to see, but I have muscle underneath. In fact, there's 2 bones in the forearm, the ulnar bone and the radial bone. And notice on the ulnar bone, which is what I see right here, is the muscle sitting on the ulnar bone. That's another digital flexor. So that one's called flexor digitorum profundus. And that one actually is coming off the ulna, so not the humerus, but the ulna, and it's inserting onto the phalanges. Okay, so that's the deepest muscle in the forearm there. And if I do the same thing, let's see if I can do that on the radial side. Okay, so I'm going to kind of push my way in a little bit. Sitting over here on the radial side is a muscle, and this muscle that sits on the radius is going to be the flexor pollicis longus. Okay, so that's flexor pollicis longus right there. Okay, so that's going to originate off the radius, and it's going to insert on the big thumb or the pollex. Okay, so that's the anterior forearm, at least the muscles that we're doing. The only other one is the pronator teres, and on this particular cadaver, it's not dissected all the way out, but I can see it actually sitting in this connective tissue here. That would be pronator teres coming across. And that little muscle is designed to pronate or rotate medially the forearm.